Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient slash survivor. I've been battling cancer since early 2021 and doing very, very well and surviving this new weather here in Texas. And we've been having some real cold weather, but it's all good. Everything else is really, really great. And I am so excited to have Dr. Nhu Truong return for part 2 of our interview. And this one here, we were just discussing briefly before we went on air, and I am really excited because I've never had a doctor willing to talk about the subject like she is, and so this is going to be uh, a fantastic interview. So please stay with us to the end. Also, please subscribe to the channel, make a comment in the comment section, and we are going to get going right now. Dr. Nhu, please reintroduce yourself. Tell us a little bit about who you are, and then we're going to get into this bombshell of a subject.
Thank you for having me, Mark, and Happy New Year on 2024 already. And may those who are watching and listening to us right now, may those always be healthy, happy, and have abundance of joy, peace, and prosperity, and always have your health of well-being and a mental peace and happiness. And thank you so much for having me on this show, Mark. I'm so honored to be on your show again.
And it's an honor and a pleasure to have you as well. So tell us a little bit about who you are. You're from Texas. We're fellow Texans now, and tell us about what you do, and then we're going to get into some great stuff.
So a little bit about me would be um, I am a holistic functional medicine mindfulness um, pharmacist that has clinical pharmacist background in the inpatient world, rounded with physicians, retail in the CVS world, implement program from independents, growing different locations, hiring, doing clinical studies like when we do lab testings for um, compounding, sterile, non-sterile. So I've done pretty much exposure to all different type, even working from home as a part of in the insurance world to approve for high cost medications. So when we talk about all aspects of the healthcare, when to make sure that the patients get their medications right and properly, I think that I've done it all. And I think one of the things that I'm so passionate about to really shine the light is we have to really take care of the patients beyond just a patient, like a number. And if we treat the patient in front of us, like if Mark were the patient saying, what if that patient is your father, your dad, your brother, your sisters, your grandmother, grandfather, or your kid, your care of how you look at from your lens would be different. You're going to be more cautious. You're going to take it with more depth. And if it doesn't work out, you're going to seek more of a second opinion. You're going to do some more research and studies on trying to figure out why it didn't work. Not just if it doesn't work, you come back and see me and that's it. Or if a patient passed away, you don't think twice about it. You don't get numb to the system and blame it on the system because you saying the system pushed you. And that's where I think for me, when you're in the heart of healthcare and trying to serve and take care of patient, we cannot be half sleeping, walking through life, working and getting a paycheck and not really care for the patient. And that's where my heart's really hurt because not many patients have a patient advocacy to really advocate for their well-being on how the treatment is properly done. And that's where we want to raise awareness on a lot of things that we need to get back to the fundamental of being human. Just love one another more kind, have more empathy and compassion for what they're going through. And that mental, not just a physical, but mental well-being on how, let's say cancer, when we talk about cancer patients, they're going through a lot, right? And for someone who's physically well to now being diagnosed to say you don't have that much time left. So I think just the shock and knowing where they are and put your foot or your positions into their shoes, how would you want to feel and how would you act? And so our words and our actions need to be aligned to really be intentions to not hurt someone and really put your best foot forward and to really care for one another. That would change the way, not only for a better world of how the patient outcomes, the result will be different, and how we live fully in the way we're supposed to. And that's how my that's a little bit of my passion on that. Mark.
You mentioned something that's a big pet peeve of mine, and that's the diagnosis. Um, my opinion is doctors are not properly trained to, in most cases, they're not properly trained to give the diagnosis in a compassionate way for the patient. They're doing it as their job, saying, "Oh, you have, 3 months to live," and all this, without true care about what those words really mean to the patient. What are your thoughts on that?
Oh, it's totally resonate because even if you know, let's say it's about 3 months, let's say, right? Studies shows, let's say, if you base on a patient care on a statistic, on clinical data, or even what you've shown, but we know data is just how it project on that person. But if we give them more power and we say, it's about that time, but we're gonna try our best. It's how you frame it because if you say, "Hi, Mark, I'm so sorry, but it looks like in your lab there's, maybe you have, X so and so diagnosis, but you might have, in most give and take, but you don't say, oh, this is what you have. You only have 3 months or X amount of months. It's like a definite, like a declaration,
Right,
like a
right.
death sentence that you saying this is the end all be all. But instead, if you say, you have this, and I understand that this is usually, but let's give it our best shot to see what we can do to figure out and how we can help you optimize, to have a better outcome in a way, in a positivity, so they have some light to work toward. And I think that will change how you care about someone because in the meantime, there's studies that people might not know that they have cancer and they live very enjoyable versus someone who declare they have cancer, their mental shut down, they go downhill because of the words that being impacted. And there's a lot of things that psychologically I think has to do with a lot because if that person that you just declare have lots of family member who pass away, they will go down, they will shut down because they know, okay, I guess I have no willpower to live because all my, that I have a lot of people who in my life have passed away. So then you're already another validation. You don't want to cause that. They're already in a situation that their physical body cannot handle. But mentally, if you thrown in another, that's another fire you're gonna put into, that would ignite something much worse versus if you're able to soothing and have a more calming and the way you carry out and that you're willing to put whatever your best effort. Let's seek another second advice, a third opinion, right? Let's do another lab testing. I mean, there's other ways you can craft it to give people hopes, is what I see, versus, oh, this is it. There's no other way. I can't help you. That is what it sounds like. And let's just prepare for the worst of what you have left. I mean, I've seen a lot that come through, they don't know how to craft in a way that they're really care, truly care and compassionate for their patients. And I totally get it. When you say that's a pet peeve of yours, and I see that's something that we need to have more of that cultural awareness on when you are patient, how should you emotionally craft in a way so it resonate and it touch the patient heart because you care versus I'm just working. I don't know what else I can do. I mean, that non-caring, it come through. And I've seen that as me being on the other side as a patient also.
I think many doctors do not realize the power that they carry with the patient. You know, as a society, we've been trained from birth pretty much that the doctor knows what they're doing and you listen to your doctor. I mean, but that doesn't mean you have the right doctor. That doesn't mean you have the right doctor for you. I mean, doctors are humans, and there's different personalities and things like that. Um, and it just drives me crazy when I talk to people and they say, "Oh, I've been diagnosed with a terminal cancer. I know I'm gonna die. There's no cure." But you're breathing, you're alive right now, right? I am, but the doctor said, there's just no known cure for it. And the power that the doctor yields, I don't think I don't think many really appreciate that as being so powerful to the person that's sitting across from them. Uh, and the words that they use are so powerful when they're delivered because you're talking about somebody's life. It's not like, you know, uh, you have a cold or you have the flu and, take this Tylenol or take this pill. You're talking about life or death. Talk about that.
Yeah, and that's truly something that when you saying they're not compassionate about it, and to me that really resonate wrong in that aspect, meaning the provider are not really reflecting in a way because we as energy, even from being silently, when you come in and you find out this patient is diagnosed with a terminal illness, they don't have much time left, even based on what you think. There's no way in for you to go in the room to comfortably tell a patient that to break them that news so easy, right? Because that will hit really hard because as a as in the field in the healthcare, you want to save every lives. And so when you come in with intentions of wanting to heal someone as that patient, even the silent moment, you wish them well, like meaning you have prayers, or even if you don't believe in the higher divine or any other, but it's just that energy that you wish them well. That alone will resonate different. And the way our words, the way we craft has meaning and has energy and has things that will feel to like that nurturing, like if you go in and you get a patient or the doctor really tell you, oh, Mr. Mark, you look wonderful today, your skin is like or bright, and it's lovely to see that you're smiling. You compliment someone versus, oh, Mr. Mark, why you so grumpy, or like in a way that you pick up only negative. But if you pick the good, right, you bring the good out of people, you shine the light so people have hopes and to kind of capture and thrive on is different. It's the same philosophy as if you telling a patient, even if they're in the worst shape. But I'm not saying to lie, but it's in a sense like if someone were, because I envision a patient who are frail, who are terminal in their bedside, but you can say, hey, Mrs. Smith or Mr. Smith, how are you doing today? How's your day going? You go in with that loving, caring, how's it going? How are you feeling? Anything I can make it better or make it more comfortable for you. If you go on a perspective that you care in that sense, or would you like to get some, sunshine maybe from the window, or like, would you like your window up? I think just having that notice of small, tiny things that you ask a patient, it goes beyond just, oh, are you feeling pain? How you doing? Are you throwing up? Or how's your chemo? Or how's this? It's only that one narrow aspect of that patient care, but you don't care about anything else. So that is not looking as a collective whole for the patient. And that is where I see when we look at any care, we have to look at all the care of the patient, not only the physical body, but mental body, like how they're mentally feeling, like are they, energetically, how are they doing? Because that will change how they're fighting for their life, and you can help them with changing that pathway if you come in with a loving kindness. You got this, Mr. Mark, you got this, Mrs. Smith, that, I see you, you're so strong. It gives you that confidence. Oh, you telling me, I'm getting better, and this, it gives you the willpower to continue on because you motivate them. Versus if you don't have any motivation, you don't have somebody to lift you up when you're already in that stage, what makes it any better? And you're the only one around 24/7 most of the time when you're in that stage, when a patient is there with you. And I think that is where, if you look at as if it's your family, would you want them just to like be miserable, even if it's their last stage of life. And for me, I think if you shine the motivation, you give them the hopes, oh, let's get up, try to do like even do a deep breathing or just a little walk or with the stroller or with the walker. There's ways that you can motivate, but also in a way that you show them that you care and you love for them, like if it was the family, then it's not just a patient. Oh, you don't want to do it? Okay. Like, it's just that quick action has no result and you don't have a feeling because it will come through on how you deliver your care. And I think that is where some people has that emotional intelligence to be able to really connect with the patient and really care in a way that go above and beyond. Like, oh, if you don't like you didn't like cold water, then you go the extra mile and to know to get you something warm water or no ice in it. Paying attention to small, tiny things and aware of what's going on. It tells you clues, but if you're just narrow in one thing and focus in one area because you only focus on the treatment and you see the lab data, but you don't see nothing else because that data, the lab machine can be wrong, right? There's an error on everything. A human being has error, percentage of error. So a machine has an error. A lab test can be false negative or false positive. So there's a lot of things I think with that. We have to consider, and we all are not perfect, and doctors are not perfect, and no one is perfect. And I think that is where we need to wait a minute, stop quick to give a diagnosis if you're not really sure. And even if you're sure, how would you want to deliver that message? And when you deliver that message, you have to be able to craft so they know that you care and love them, that you've done all that you can for them before you deliver that message.
Do you think that most doctors just kind of get sucked into the system and are because of the time pressures
Yes.
and things like that, they lose that compassion. Because at some point, people become doctors because they want to help people. But then, kind of like politicians or something like that, you get into the system and you just start going through the motions because there's just so many people. Do
Oh,
you think?
like right now, Mark, you see a lot of in the news, like healthcare are burnt out because the system squeeze the healthcare professional. They put like a lot of patient in X amount of time, so you only have less than 5 minutes. When you go in, you have nurse and all that to triage and do all the prep. But the doctor go in, if you really time them, they're not there that long
Right, right.
because they cannot if they need to go see so many other patients. So I get that they're being pushed to the limit and it's being burnt out, but then for me, if you're in it, right, and we have to, in a way, have to step back and realize, are we doing any justice for the patients that we're serving if we're just going through life and collecting a paycheck and knowing that we didn't really take care of the patient to the best that we should. Let's say if it's 5 minutes, maybe it should be 10 minutes. So if that doesn't work, how about we implement something, a protocol, a handout, or like before the doctors go in that you specifically want to ask and have a triage so you have something to remind yourself, did the nurse get that or did I get that, so that way you have a check and balance to make sure you follow through. Because if you blaming on the system and saying, well, the system is giving me this much time and my KPI, my metrics is saying you're too slow, you gotta go faster, and you're making error because you're not having that much time to really look at the patient, as in that's why you have medical errors, why we have surgery that are operating in the wrong parts of the body, wrong person, right? When the A patient should be operate on a foot, but they got removed on an arm. Like there's things that, yes, the system, but we have a saying, right? We contribute to it and we need to put a pause and we need to sometime reflect. And it's going to hit home because this is a sensitive topic that people will not like that I'm going to bring up the topic because we have to put a mirror in front of us, right? And sometimes self-consciously we have to really look and saying, did we do our best? If it was our family in that bedside, would we make the same decision? Would we half treatment or half diagnose or half seen and not look at the patient wholly because now the insurance, let's say reimbursement is low, you got to have more volume to equal to make up the salary that you wish, or there's other factors in the system and billing, and so there's a lot of in the back end. I know that it's not their fault, but at the end you control, meaning you can either be a part of something that it has to be ethically right. Because if you were in that bed, would you want to be treated like that? And I think if the provider will hit hard and reflect, and if you were in that patient and someone just don't care enough about you to find out if it really is that diagnosis, and they're just gonna give you the wrong medications for the wrong diagnosis, then you're gonna have an allergic reaction, all the rabbit hole to come down, a side effect and all this, or a surgery that wasn't supposed to have a surgery. Maybe there's other ways that you can, alternative ways that you can treat someone, right? And I think because you're not open mind to look at other options, you only zone into a quick, easy to make money out of the system. If the pharmaceutical give you a protocol, this is the formulary you should give a patient because of the reimbursement. Oh, now the next month or next year, now this new drug come out, let's give that. So that is where we need to put a stop to saying, is that the right ethical way, right? It's not just because all the pharmaceutical money, I mean, all the pharmaceutical that they put a lot of money to do their clinical studies, they have bias, right? Because they want the result.
Right.
And if when we want to get real, I'm not saying all drugs, I'm saying there's always a side effect, right? If you quick on giving someone a prescription for something, you're gonna have a side effect. So if you don't really look at the root cause and you quick at giving them a pill, oh, I'm gonna have a side effect to this A drug. So if you have it, I'm gonna give you another drug for the side effect. You keep on adding. So you are in control of that patient. Now you have to come back to see me, so I give you that medication, and you're ongoing because now it's feeding that loop of the doctor's in control to be seeing the patient to get the money. Now the pharmaceutical are making the drug to get the patients to continue on it. To some degree, do they want to cure you? Some of it, I mean, there's that's the where we have to get real on some things. We have to really treat, like, get rid of the root cause, not just put a band-aid. And that is where a lot of things we don't want to look, or maybe we're biased, or maybe we're having a good, making a good money, living out of it, and you're so zoned into it and you don't care. But reality is, there's always there's higher politics, right? When we talk about politics, there's higher than all any of us, and I get it. I get that they're there to make money, and it's that's the sad part, is that we're being controlled because it's it's uh, it's like the power. Someone's higher, have more power, they're gonna get control versus somebody who don't have the power. That's the reality of no matter what century we are in. We're in 2024, but they don't show it in a way that's so obvious in other ways. But all I'm just saying is that there are some things that does need medication. There's things that does need, like, flu shots and other things, because I'm a provider, so I'm not saying against anything. If it's antibiotic, there's things, infections, but there are things that are, I would say we have to have a cautions before we automatically give someone medication. Like, let's say ADHD, a kid who's saying, oh, they can't sit still. There's other ways we can make them, meaning to not be so hyperactive, but in a way so they can focus without having a quick giving them a medications that can have potential side effect like suicide, right? Or like anxiety and depression medication, same thing, or bipolar. When we're talking about things that are so quick to give people medication, but it doesn't really get to the root cause. It just only numb to the point so they don't feel it. Doesn't mean that internally they still have that issue. And that is where I think ongoing, there's a lot of things that we need to look at. Of course, it's what we eat, our nutritions, and we are what we eat. And there's a lot of things that we consume that also cause us to have all the things that our health go down, right? Our stress, it's just so much factors that I think this is not in our society right now, Mark. I feel like everybody wants quick, right? Like fast food, like McDonald's, or like, they go in and they expect, I want it, whatever my pain is, make it go away, right?
Mhm.
And so I get the patient demanding that of the system or the doctor. So the doctor says, okay, I'm going to give you this to kind of quiet everybody. So I don't want to hear about anymore. But that is not how we go through life, and it's gonna end up somebody gonna pay for it, and the patient's gonna end up paying for it.
I'd like to ask you something that I haven't done in actually years. Uh, would you mind coming back for a part three? Because we have so much more to discuss. We really do. And
Yes, yes.
I
No,
think
it's
we,
I know it's I, I say, you know, that is where I see so many people who don't know. And when you're in it, you see so much mess that you're like, no, why are we doing this way? Can
right,
we, can we look at in a view of how can we collectively come together? Western herbals, ancient, like Chinese medicine, plant based. There's other things. When how about we combine all of it? But reality is that when you have the willpower that you want to fight for your life, right? And I see that in you, Mark, that you have the willpower to fight for your life so that you bypass even whatever months that you have now it's years into well-being. Now you are sharing the light to others so that way we can help others to
right,
know that the only person that should have the power is you. We like meaning the patient. If you going through a struggle, don't let any doctors, not anyone to tell you that you have X amount of days. You can, if you have the willpower in your mind to bypass it, you have the willpower to live on and fight for your life, then you will find a means, right? You can find ways and different ways to really treat or delay or suppress, or in a way to lessen the severity of whatever stage that you're going through. And that is where I think when people listen to us, they have to understand that, I know it's sad that there isn't a patient advocacy in the healthcare, not always. But if you do have those, then hone in and keep them because they are treasure. They are advocating for you. But even then, you have to be the one. You have to know what's best for your body. Don't, if, I'm sure you know that, Mark, we have to really, um, really, only us, we know that something's not right. When we feel something and the doctor say, oh, you fine? No, if you feel in your guts and something is not right with your body, you know your body best. And that is where you have to take in control back and not just let them say, this is what you need. You have to be in control and know every step, every stage, every treatment option you have and do your research. So you know what's best for you. And that is where I think we can leave it for this episode. And then we'll continue on with our next one.
Sounds good. I can't thank you enough. And I love the way you advocate. I love the way you shed light on on a different point of view, which it is so helpful to anybody going through any kind of health issue or health crisis. And instead of just saying, go to your doctor, show up and say, I'm here, heal me. It's a lot more than that. And it can be a very powerful experience for you if you're willing to advocate for yourself and realize that the person in front of you is not God, it's a human being. And if we are able to work together, then we could find the best solution for you or I. And I just love talking to you, and I love hearing what you have to say. I'm not going to ask you for a final thought because I can't top what you just said. It's just so incredible, and I thank you from the bottom of my heart, Dr. New. It's just fantastic.
My honor, Mark, and I truly do want to always take away the suffering for anyone who are going through any kind of struggles. And that's my wishes for everyone to always be healthy and happy and have no suffering at all. Because no matter if it's a physical, mental, any kind of suffering, no one deserves suffering. And that is where my heart lies and always will be cheering on and supporting and always here for anyone who are struggling, really, because when everyone's happy, no one needs anybody. But when they're down and struggle is when they need somebody to lean on the most.
Right, exactly. I I can't say anything better than that. Thank you so much, Dr. New. It's just been fascinating. I just love our topic, and we're going to talk about some more. We didn't even scratch what we're
Oh,
going to
there's
talk
there's so
about.
much.
Yes. So, and I want to thank each and every one of you for joining us at To Be Your Own Hero. And I can't wait for part 3, and we're gonna bring that out next week. And so thank you once again. Please join us and subscribe to the channel, make a comment in the comment section, and have a phenomenal week. Thank you once again, Dr. New. We'll bring you back again. And thank you to everyone for joining us at To Be Your Own Hero. Thank you.